Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Wednesday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, January 4th. We invite you to submit your questions via Facebook at any Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Leading the discussion today is myself, Sylvie Bukowski, Student Research Assistant with the Institute for Dr. Murphy. I'm going to start with some updated COVID statistics. In the United States, yesterday we saw 76,128 new cases. We are seeing a 10% decrease over the last 7 days, with our 7-day average being at about 60,000 positive new cases every day. Hospitalizations have increased by 8%, and fortunately, the death rate has decreased by 24%. In Illinois, yesterday we saw 5,086 new cases, with our 7-day average decreasing by 37%, with it peaking at about 2,000 cases per day. Hospitalizations are decreasing by 12%, and the death rate is decreasing by 26%. So, all in all, these statistics are great. Everything is decreasing. Should we be worried about the wave to come after the holidays, Dr. Murphy?
Well, remember how this goes. People come in contact, and then within about a week, if you're going to get it, you get it. That would be the first generation of people infected. Then those people, obviously, some of them will spread it. Infection comes first, symptoms come second, severity of disease comes third, hospitalization comes fourth, ICU admission comes fifth, and whether you make it out of there, that's the last measurement. So that takes time. And so since the holidays are over, people are back at work, all this moving around has, slowed down. Obviously, it hasn't stopped, but it's the wave is we're like at going up the peak. So what you're going to see, you'll start seeing the cases drop, but the hospitalization rate and the death rate may pop up because that's going to take some time. So January is going to tell the story. Now, at the same time, what's going on, and we're going to talk about it later, is that there's a new variant in town. And this new variant is much more contagious. It gets around all the antibodies, including Evusheld, and we'll talk about that in a minute. But anyway, so all these things are happening at once. As long as there's a lot of replication, there will be new variants. That's just the nature of the game.
Yeah. Absolutely. Well, going into our first COVID headline is that China could see nearly 1 million deaths as it exits the COVID zero strategy that they've been using for so long, a new study is saying. So what can you tell us about this?
Yeah, so we don't know. So the reason why China's in so much trouble, there's two big reasons. One, their very severe lockdown policy, the zero tolerance policy, what that meant is very few people got COVID. Very few people ended up in the hospital, and very few people died. I mean, all that part is good. However, since hardly anybody got infected, they don't have any native immunity. They don't have any immunity from the infection because hardly anybody got infected. Now it's just coming into the population, and everybody's, quote, naive to the infection, so it's going to spread like crazy. Now, of course, vaccines provide immunity, and they've got, I think, 9 vaccines approved in China, but they're the older technology. They don't work as good as the mRNA vaccines and the Novavax adjuvant vaccine, and so that impact is going to be less because of the type of vaccine they had. Now, in Hong Kong, they did have the mRNA. They had at least the Pfizer vaccine. So they were pushing the vaccines early on in the epidemic, but they weren't so aggressive with the boosters. So not only were the vaccines weaker, but most of the people that are vaccinated have just had the 2 first shots. So they don't have the boosters even. And so they're behind in that too. So, no native immunity, weaker vaccines, no booster shots. The same thing happened sort of in Hong Kong a couple months ago. You may have remember there was a lot of deaths and stuff because a lot of older people hadn't taken the booster shot. The boosters really help. And China just decided they gave up when there was riots in the streets in almost every city. They said, okay, this is just not worth it. And their whole public health campaign really fell apart at that particular point. I mean, they just canceled it. And so we don't know what's going to happen, except it's going to be bad. Because no one thinks that they have the capacity to handle all these sick patients. And the pictures that are coming out of China look pretty scary with, lines going into hospitals and people all over the place, similar to what it was in the United States in the spring of 2020. Remember in the Northeast part of the US, it was really a disaster. So there's 3 groups that have done modeling. And they all come out with, of course, different numbers, because a model is not reality. A model is just a prediction. But the lowest of those is the one that comes out with approximately 1 million deaths. Now, we have 1.1 million deaths in the United States. We have the highest death rate of all high-income countries, essentially, or the top 20. So 1 million deaths in China. China has 4 times as many people as the United States. So 1 million has to be looked at in the context of how many people are in the country. So that's actually a relatively low death rate. However, there are several other models, including one by the WHO is pushing, that are as high as 3 million people dying. So, it's kind of all over the place, but the point is, it's going to be severe. We don't know what it is until it happens.
Right. Well, going into our next COVID headline, which ties closely into this, is that a highly immune-evasive Omicron XBB.1.5 variant is quickly becoming dominant in the US as it's doubling every single week. So what can you tell us about this new variant that is taking over?
Yeah, this variant is taking over, just like other variants took over. Remember, Delta took over, and then Omicron, and then, and so forth. Now, these are the subvariants of Omicron, the Omicron 5. So this was first discovered in India, was reported last August, and it quickly became the dominant virus there, also in Singapore. This variant is different. It takes over because it can replicate better. I mean, it's a better virus. And it gets around all the antibodies that are in the population. That's why it spreads so much. Now, it doesn't look like it's really any more dangerous, but the current antibodies, like in Evusheld and stuff, will probably not work. Because of this, what they call immune evasion. So it's unfortunate. So people with weak immune systems are going to be much at risk. Now, the treatment with Paxlovid, the drug, should still work. So the treatment is still effective. And if people do get infected now and they meet the criteria for treatment, it is still being provided by the government at the local pharmacies. The US government made a massive national purchase, and people should take that if they're eligible. So, you just have to be 50 years of age and older, or have some kind of immunocompromised condition or medical problem. And there's a whole list of them. It's almost like every medical problem. And that goes down to age 12. So, if you have any concerns, you should talk to somebody who knows a doctor who treats COVID. I've heard a lot of patients say, well, you're healthy, you don't have to take it, even though the person is in their 60s. This is not true. People over 50 should take it.
Well, yeah, no, absolutely. Going into our first COVID headline, our first COVID question, I apologize, that I think is very connected to this is, after talking about all of this, Dr. Murphy, when are we going to see the outcome of the holiday season spike in cases? Will there be a spike in cases, do you think?
If you just put together what I said previously, with the infection, and then you get symptoms, and then you get sick, and then hospital, that's the trajectory you're on. You're gonna see this in January. So we're in January.
Mhm.
So, the holidays are over. The movement has, slowed down to a dull roar. We'll see it in the next couple weeks.
Yeah, great. And then our second viewer submitted question is, what is the updated research on rebound COVID after taking Paxlovid?
Mhm. Yeah, so I had rebound. Dr. Fauci had rebound. There were a couple other
Mhm.
kind of people that are well known in the public that had rebound, and that kind of highlighted it. But it's a relatively small percentage. So when they did the studies, the studies were done so long ago that probably is a very different virus, and it's not that they missed it. It probably didn't happen because it
Right.
was a different virus floating around when they did the Paxlovid studies, which was quite a while ago.
Mhm.
So now these new studies look at 7 and 30-day COVID rebound rates, and they're ranging between 3.5 and 5.4%, which is not surprising. There's been studies that shown that the person is not resistant, resistance is not a big problem. So that would be the one fear, that all of a sudden you're resistant to this stuff, but that hasn't happened yet.
Mhm.
Molnupiravir looked a little higher, 5.8 versus 8.6%. But not that many people take molnupiravir, but it is available, and it does work. It's just not as good as Paxlovid. But the rebound rates are pretty low. So it looks like it's like 1 in 20 people are having these rebounds. And then there's a lot of questions whether those people should be retreated. And there's a recommendation is not to, and then some people do get retreated. So that's kind of a little bit all over the place. That should be left up to you and your doctor, whether you
Mhm.
need retreatment. I can tell you when I got, my rebound was worse than the original infection. And I took a second
Wow.
course of Paxlovid, and I know the same thing, other people that have said that publicly. But anyway, that's up to your physician and yourself. Now, let's
Yeah.
see.
Well, thank you.
Yeah, and that was also mentioned here. Yeah, that we already talked about that, why it probably didn't happen in the Paxlovid studies, because it was a very different virus. So those are the take-home
Yeah.
points on the Paxlovid rebound situation.
Well, thank you, Dr. Murphy, and we will see you next Wednesday.
All right, great. See you then.
Bye.